with, let's start with number one. Come on over. Remember Diana? We're going to meet her elbow today. So we're going to talk about the varus and valgus stress test. So this is a test that you will use in real life to figure out what could be wrong with somebody's elbow when they come into your office. So we're not going to talk about injuries or, don't worry too much about exactly how to do it. You guys can practice this. Don't accidentally, do like a UFC move and rip someone's elbow off. When you touch a lot of elbows and do this, you'll learn how hard to push. You've got to push firmly. You've got to remember the idea behind this, right, is that I've got a rope on the inside or the outside. That's a ligament that I'm trying to push on enough where I get a good idea of the integrity of that ligament. So if I kind of baby it, then it's not really going to work, right? But also, I don't want to crank on it. So I'll show you this idea of varus and valgus, and I want you to just think a little bit about, I'm not going to answer these questions right now, like these questions that are written here. You don't have to write it down or do anything, but just think about it. Think about these questions that I have on the lab sheet, and then when Diana's done, we'll go over some of these questions. So a valgus stress test. So we talked about what valgus means, right? It's going inward towards the body. So the number one thing to remember with these tests is that when I push, I do not want to create motion at the elbow. So remember we talked about a similar concept. We talked about mobilizing the MCP, where I don't want to create flexion or extension at the MCP joint. This is similar in the sense that I don't want to create elbow flexion or extension. So what I'm going to do is I've got to create a counter force at the wrist. So I've got her wrist here, and I'm sort of pushing in this direction. It's going towards me, and her shoulder is just sort of hanging there, but I've stabilized her at the elbow. So I've got the butt of my hand is right, let me turn that. The butt of my hand is going to be right on the lateral aspect of the elbow. So I've got the lateral epicondyle that I can palpate. The brachioradialis is sticking up right here. It's a big muscle. It's easy to see. And turn towards them again. So that's where the butt of my hand is. I'm not pitched anteriorly or posteriorly. I'm right on the lateral side. Again, I'm on the wrist, and I'm going to push. It might feel a little weird. Does it feel a little weird? Yeah, it feels weird. So what I'm trying to do is just open up this medial part of her elbow. So again, think about what structure could I be pulling on. We'll talk about it later. So I'm doing a little push, a little wiggle. Now, what'll happen in real life is someone will either say, ow, and that means that something is damaged there. Yes, this is a Kimura armbar. And if she taps out, I'm pushing too hard. So if it hurts, that means that something's wrong with something. We'll talk about it later. Sometimes, unusual in this case, this happens way more in the knee. You guys will learn the same test for the knee. It happens way more there. Sometimes it's really loosey-goosey, and I can push. And when you guys feel a bunch of elbows at some point, you'll get a sense of what normal would feel like. It should be pretty stiff. We talked about the elbow's a pretty stable joint. You'll feel it kind of gap way too much, and you'll be like, oh, okay. So that either means it's totally torn, it's very stretched, something like that. But I'm pushing in this valgus direction. Now, same thing, I'm going to come over on this side. We're going to do a varus stress test. So it's all the same kind of stuff, except now I'm just going in the other direction. Remember an important point of this, I'm going to tilt this a little bit, is this counter force. So now in this case, my counter force is going in my direction again, but in this case, it's going towards the midline, my counter force at the wrist. Now my hand, the butt of my hand is on this medial side here. So I've got my flexor muscles that come up this way. My medial epicondyle is over here, and I'm on the medial side. Again, I don't want to go up top or on the bottom. I'm right on that medial side, and I'm doing the same thing. Feels a little weird. Less weird. Again, very stable structure. I don't have a lot of movement. I'm not creating flexion and extension. I'm basically trying to gap this outer part of the elbow. Think about what structures I'm pulling on and potentially compressing by doing these things, okay? Just think about it purely from an architectural standpoint for now. That's the varus valgus test, okay? Let's talk about palpation. So we talked about this a little bit during the lecture. Palpation of the radial head during open chain supination and pronation. While I'm doing this, think about the arthrokinematics. We'll talk about it later. So we did this yesterday. Let's go over, Monday rather, we'll go over it again. So if I'm trying to palpate the radial head, okay, here's my olecranon process. I'm gonna go lateral to that. And what I'm gonna feel first is sort of this tip of the trochlea here. It's like, not really the trochlea, it's just the tip of the distal part of the humerus. I've gotta then go sort of distal to there and a little bit more lateral. And now I feel another bump, okay? The main way to know if you're on the right bump is to rotate into pronation and supination. And I can feel this thing spinning. You kind of feel that under my thumb. You can feel this bone spinning under your thumb. If you are still sitting on the humerus and you rotate, it ain't gonna do anything. So if you don't feel it moving, you're on the wrong bump. So you might have to move, again, a little bit distal and a little bit more lateral, and you'll be right on that radial head. You'll feel it spin. So again, you can do this to yourselves. Someone said that they feel crunching when they do that. I don't know what that means. Should probably see a physical therapist, let them evaluate it. But yeah, could also be normal. Joints make noise, it's fine. Noisy joints can be good, they're not good. Normal, they can be bad. If it's a painful crunch, then we don't like that. But you guys will feel joints click and snap and they make noises all the time. It's not always indicative of something pathological. So that's the pronation and supination at the radial ulnar and the proximal radial ulnar and the humeroradial joint. Think about what the arthrokinematics are at that joint. We'll talk about it later. So now let's do this closed chain pronation and supination. This is tricky, but let's talk about it. So we need this thing. So can you basically just go, let me just see something here. Go something like this. Pretend you're in a 3-point stance and you're leaning on that. Okay. Can you guys see that pretty well? You can see her arm maybe kind of, right? Okay. So let's just read through this little paragraph here. This is the description from the book. You have a person bearing weight through the upper extremity right here. We have elbow extension, we have wrist extension, okay? That's sort of constant. So right now in this position, if I rotate the arm in, now it's already kind of naturally a little bit internally rotated, right? If I rotate the arm in, what I'm basically doing is I'm facilitating a supinated position, right? That the rod in that picture, right, is they're basically talking about the axis between the epicondyles, okay? That's the rod that they're talking about. So in this case, right now, hers is kind of going in this direction. If you guys can see, it's going like through this way. That's where her epicondyles are aligned. So what is happening when the shoulder internally rotates, okay? I'm turning her more and more in. I'm not sure if you guys can see. So I'm just kind of doing this passively. I'm not asking her to do that. If I turn her in, do you see how the relationship between the condyles and the wrist turn her into more supination? I hope you guys can see this. I wonder if I could get this lamp on. Hang on. I'm going to get a little bit more light in here. That might be better. So now I'm going to ask her, so rotate your arm in like this. So what should I be able to feel? Maybe a little bit of a lat contraction, okay? Maybe a little bit of a pec contraction. It's more pec, probably because she's weight bearing. So I can feel under here, I can palpate her pec major, and I can feel it just kind of turning on a little bit. Now, maybe I can feel a little bit of the supinator, but primarily this is being driven by the shoulder. And what happens is as she rotates in, see this relationship here, this turns inward because of internal rotation of the shoulder. It brings the ulna along for the ride. And now, because I'm weight bearing through the arm, the radius is fixed. And now my ulna, which is not what happens in open chain, my ulna, because the humerus comes along with it, can rotate around. And if you look at the relationship between this axis and her hand, I'm moving into supination. I'm moving into this position, okay? Conversely, if I tell her now, rotate your arm outward, okay? Now I can feel this muscle here, the infraspinatus, okay? Infraspinatus, I can find the medial border of the scapula, and I go just lateral to that, right in that space on the scapula, and I could find the infraspinatus, and I could feel it contracting a little bit. Now, take a look again at this here, this rod, as it says in the picture. What's happening now is I am turning outward externally at the shoulder. You can feel that infraspinatus performing that, and she turns out, and now the relationship is turning from this into this position. So instead of her forearm doing this, her forearm is staying static. So instead of this happening, this stays here and the rest of it moves out. So she's actually going into pronation of the forearm. Okay, so just think of it as, because my radius is planted and fixed, now in order for pronation and supination to happen, my ulna has to move. And in order for my ulna to move, because its articulation with the humerus doesn't perform pronation and supination, the whole deal has to rotate. So that means that the shoulder, just to go over one more time, if I internally rotate, it brings my ulna along for the ride going in this direction. And it actually takes, if you look at the axis here, if I take this little line going through the epicondyles and I turn it this way, the relationship with the hand goes into supination. Now turn the arm out. Now I'm going in the other direction. Now my humerus rotates, brings the ulna with it, and my radius is fixed. And now that relationship between this line and my hand turns into pronation. Okay. We have a hand raised. I think it's Purvi. Yeah.
So when you're when the radius is fixed, you're internally rotating, you're supinating the humeral-ulnar joint, right?
Well, no, you're supinating the forearm. The humeral-ulnar joint does not supinate or pronate. So that's why the humerus has to go with it, because it doesn't pronate and supinate. Does that make sense?
So then
like the whole thing moves with the humerus. It's not this. That joint is not rotating. The whole line from the humerus down to the ulna is moving, but the actual pronation and supination is still taking place at the proximal distal radioulnar joints, and the radiohumeral joint will spin also.
So the line where the epicondyles meet, that's like what's coming forward, right?
Right. Like think of that line is the humerus, and then the ulna in this motion, the ulna and the humerus are like glued together, because they don't do this. So they're glued together. So that's why we look at the epicondyles, because that whole thing is moving around and the radius is fixed. Okay. Whereas if I just do this, my ulna and my humerus are fixed and my radius is the thing that's moving. Does that make sense?
Okay. Yeah, that makes sense.
Right. So, and it's a good point. Don't confuse it with the humeral ulnar joint actually supinating, because that is glued in this case. That's a true hinge. It can only do this. So in this case, that's why the humerus has to internally or externally rotate, because if it doesn't, it ain't going to go anywhere because the radius can't move. Okay. So that's the closed chain internal external rotation of the shoulder coupled with pronation and supination. Okay. So we talked a little bit about the palpation of the internal and external rotators, okay? So let's go to the third thing. We're basically gonna do some muscle palpation. Some of these are really easy. Two of them are not as easy. So we'll do the best we can to try to illustrate this through video, okay? So the first one is the biceps brachii. Let me get this thing out of the way. Biceps brachii is really easy. Turn to the side, please. Take a half a step. I'm going to tilt you down a little bit. That should be good. Okay, so all we want to think about here is, what does the bicep do? Elbow flexion, shoulder flexion, supination of the forearm. So how can we make this muscle pop up here? We know where it is. It lives on this anterior part of the humerus here, right? It basically covers this whole space very superficially. So if I want to make it activate and palpate it, we can have her actively do it, but that might not be enough if I really want to make it pop. So she's going to supinate. Actually, you know what? Take a half step this way. Let's get your whole hand in view here. And then I'm going to tilt down a little more. So she supinates the forearm. She's going to do elbow flexion. Now, usually that's enough. You don't really have to flex the elbow too much with people. But I can already see, even with just supination alone just go like this with your hand. Yeah, I can just see there alone that bicep pops up, okay? Now I can resist these things. I can push her into some amount of pronation. So I can push this way and into elbow extension. So let's say I do that. So resist me, okay? Don't let me push you. I'm gonna try to straighten your arm out and turn it this way. So turn the palm up to the ceiling. Okay, right here, turn it first, good. And I'm gonna push. So I'm doing both of these and you can kind of see that bicep pops up, okay? That is in contrast, so just to go over it again, supination and elbow flexion are the most important. If I really want to be picky, I can say, okay, also lift your arm up like this a little bit while you do that. You don't resist me. Yeah, she's always resisting everything. You're gonna come up a little bit this way, right? So as I push, you could argue that maybe I get a little bit of a better contraction if she goes up into a little bit of elbow, shoulder flexion. Not usually necessary. You'll get a good contraction if you flex and supinate at the elbow. Okay, relax. So next one is brachialis. This one's a little tough. It's tough to palpate. It's a deep muscle, so it's not going to stick out at you. Some people you might not be able to palpate it on. Depends on how much muscle they have, soft tissue, whatever. You might not be able to feel it on some people, but some people you can. You can probably feel it on yourself also. This is one that it's easy to see your bicep and palpate it. You might be able to do this to yourself. So I'll do it to Diana, and then later on when she leaves, I'll show it to you how you can try to do it to yourself. So in this case, we'll talk about why a little bit later. I'm going to have her resist just elbow. I'm pushing into extension. So she's resisting me pushing her into extension, and she's performing elbow flexion, but I'm going to fully pronate the forearm. We'll talk about why in a little bit. So I haven't really asked her to do anything yet, except just you hold your arm in just like you're doing. It's great. So really the only way that I can possibly palpate her brachialis, here's the bicep as we just discussed, kind of lining this whole anterior part of the arm. I can find sort of the lateral ridge here of the humerus, and I want to try to sneak underneath the lateral part of the bicep, okay? So what I might ask her to do, again, relax. Let me just support your arm, like drop it all the way, yeah. So now I may cradle her arm like this, okay? And then I'm gonna come from here. Now her bicep is totally relaxed. It's not doing anything. I've got the forearm pronated. Now I can here's that lateral ridge of the forearm, of the humerus. I can move her bicep over almost, and now I'm on. Does that feel a little uncomfortable? Yes. It's a little weird. This is a part of the body that no one's ever going to poke at, right? I move the bicep out of the way, and now I'm kind of pushing my fingertips kind of flat onto the anterior part of the humerus. Okay, so I might be able to feel a little muscle belly there. That hurts.
Feels weird.
Feels weird, yeah. And when you get into palpation and you start poking at people's muscles that are under other muscles and they've never been poked at in their life, it's never going to feel good. You guys will palpate the subscapularis at some point. It feels like death. The psoas in the hip is the same. They don't feel good. They're muscles that you don't poke at. You're not going to be palpating many brachialises in your life, but you might. So now my next step is to say, okay, hold this here. I'm going to push you down. Don't let me push, but keep your forearm there. So now I'm going to push, and I can kind of feel this little thing. Good, and relax. You guys aren't going to be able to really see this. I can feel popping up under my fingertips, getting pushed again. This little thing popping up from the anterior surface of the humerus, okay? It's tricky to palpate. The key points of this are cradling the arm. So, if I were to do this in real life, I might do this like this, and I might do something like this. I'm doing it the other way because I think it's easier for you guys to see. But I want to cradle the arm first so she's relaxed but in a flexed position. So the bicep is on slack. Pronated flexed elbow. So the bicep's on slack. Now I get into my position, lateral ridge here, and I get right on top. Now getting pushed up.
Oh, this feels worse.
Feels worse. I'm probably pushing harder with my thumb, so I apologize. But what I'm trying to do is palpate the brachialis. We'll talk about the little things that I'm doing and why I'm doing them exactly a little bit afterwards. But that's how you palpate the brachialis, okay? Next one, much easier, brachioradialis. So now I'm here, neutral pronation and supination of the forearm, okay? Elbow flexion. Right on top, right on this, some people, I'm going to be used, I don't know if they call this anymore, the lateral wad, this big wad of hunk of muscles here on the dorsal surface of the forearm. You know, there's a whole bunch of muscles here that you guys know about, but with the brachialis, this I can come over this way, much easier to palpate, sticking out right on top. So she's going to keep her forearm neutral. Same thing, don't let me push you down. So you're popping right up there. That's it right there. Very easy to palpate, okay? Again, think about forearm position. Why does that matter? We're going to talk about that again, okay? But elbow flexion, so we've got basically, we're trying to palpate these three muscles that can perform elbow flexion. Think about why. I've got one here, and one here. We'll discuss it for a couple minutes later on, okay? Tricep, also relatively easy to palpate. Big muscles sitting right on the posterior part of the arm. So we've got three heads, okay? So the first thing is to just basically say, okay, she can do an isometric contraction of this. It's much easier for her to do. So just kind of lock your elbow out like this, right? So you can see, there's the muscle right there. Now, as the name would imply, I have three heads. Turn a little bit like that. I've got three heads of this muscle. So only one of them crosses the shoulder, okay? That would be the long head. So let's say for whatever reason, I want to accentuate and focus on the long head of the tricep, okay? I would also now ask her to extend the arm, keep the elbow locked. Maybe I give her a little bit of a push, so again, push back into me. Now, what can I see here? This guy starts to pop up a little bit more as she goes into elbow extension. The other tricep muscles, they're still doing something because they're extending the elbow. They're not going to be accentuated because they don't care what the shoulder's doing. But if I ask her to go into a little bit of extension, can do it again. Thank you. This muscle starts to flex a little bit more, okay? If she's in neutral and I have her just kind of straighten out, just lock the elbow out, don't worry about bringing your shoulder back out. Now they're kind of all going to pop up. Remember, long head is over here, it goes all the way up, crosses the shoulder joint, as we just said. The lateral head lives here. The medial head is kind of this shorter muscle that's down here, okay? These muscles, if I had to say which of these, you can relax, are of real clinical significance, it usually ends up being the medial head. The ulnar nerve lives right there. I think we discussed a little bit the cubital tunnel and how when the elbow is flexed, we're yanking on that ulnar nerve a little bit. It lives right here, goes through that cubital tunnel, and then travels into the rest of the forearm and the hand. That medial tricep muscle can be a point of kind of weird dynamic soft tissue irritation and compression of the ulnar nerve. So of the three triceps, anecdotally, that's one that I end up having to pay some attention to from a clinical perspective. But again, tricep, relatively easy to palpate. You want to accentuate the long head, we add on some shoulder extension. Last one here is going to be the pronator teres. Turn to them. Right there. So the pronator teres is somewhere in the middle. It's tricky to palpate, but I think it's personally easier to palpate than the brachialis. Brachialis is really tough. But the pronator teres, as the name would suggest, it pronates the forearm. It's all it does. So what does it do? It starts here near this sort of flexor complex, right? It's part of these muscles here that arise from medial epicondyle and some structures around it. But for palpation purposes, we can start here at the medial epicondyle. Is that tender? Not so bad. Some people, this is a little tender. and it basically runs here to roughly the midline, or the middle third of the radius, roughly. So easy to see. If I've got a muscle that's like this, when it pulls, flips the radius over. So that's how I palpate it. In isolation, I'm not going to be able to palpate it much. So if she turns down, so you're going to turn your palm down this way, and I'm going to resist that motion. Okay, so ready? Now see if you can watch this thumb. Okay, watch my left thumb over here. Let's see if you guys can see it getting pushed down. You see it pop up a little bit? I know it's hard to see, but I can feel this little ridge. Good, you can relax. That is running, again, it's running in this direction. So when you're trying to palpate this, if you feel a bunch of stuff popping up and it's unclear which thing is the thing, because you might get a little bit of some of the elbow flexors might be kind of doing something, or maybe you're getting some of the wrist flexors if the patient's doing something weird. But what I can feel for, go ahead and do it again, I can try to feel this little thing and a consistent little rope that kind of runs down in this direction. The best spot to see it is here, because it hasn't dived underneath some of the other muscles. Dove in? I have no idea, but you know what I mean. It hasn't gone underneath these superficial muscles yet, okay? So I've got a nice little bump here, but I can start to follow it, again, medial elbow down to the middle third of the radius, okay? We're on time today.
Yes.
You're done. You can go back to yelling at people. She doesn't yell at me. So,
Professor,
yes.
sorry, I had a question.
Yeah.
So I saw I think it was the part exercise 4 where you have to concentric and eccentric.
So yeah, we're going to talk about that in a second.
Okay,
but yeah,
cool.
Keep going.
Yeah. Okay, go ahead.
Oh, okay, yeah, that's fine. So, and if I don't answer what you were going to ask, just let me know. So let's talk about exercise 4. This is the video. This is the thing you guys are going to record, okay? I owe you guys, we split up the feedback among me and the other 2 lab professors. I owe my people feedback on Flipgrid from last week. I'm very sorry. I promise you I will do it. And then I'll give you guys feedback for this, obviously, too. So exercise 4 is what you're going to record. So all you're going to do, and this is, again, I want you guys to do this because I want you to just drill this concentric, eccentric thing into your mind so that you've got it like totally firmly. So it's going to be perform a concentric contraction and an eccentric contraction of these 2 muscles, okay? You can use manual resistance. So that's if you have a partner. I mean, I guess you could kind of do it to yourself. You can't really resist yourself in this case. It's kind of weird. You can use a band. You can use a dumbbell. You can use a book. You can use I don't care, anything. Something with weight, something, you could probably just use gravity. I don't really care. But all you've got to do is perform those 2 muscles there, the biceps brachii and the pronator teres. Think of a way to perform a concentric and an eccentric contraction of each of those muscles. So, if you wanted to use manual resistance, you could probably push on yourself and do this. As long as you describe what's going on, basically all you're going to do is describe, okay, what I'm doing right now are these motions at my elbow. And because I am doing that, I know I'm doing a concentric contraction of the blah, blah, blah. And then I go in the other direction and I am doing an eccentric of the whatever, right? So just describe a little bit what you're doing, how you know what you're doing, and describe what a concentric or eccentric contraction is of the given muscle. Shouldn't take too long, but just make sure that you're kind of hitting on these points of for example, if I was doing the deltoid, you could say, okay, I have a dumbbell in my hand and I'm lifting up into abduction. And I know that right now I'm having a concentric contraction of the deltoid because I'm going into abduction, and that's what the deltoid does. So it's concentric. And now as I lower down, I have an eccentric contraction of the deltoid because I'm lowering down to the floor, controlling the weight, something along those lines. But you're going to do it for those 2 muscles, okay? The next part, another concept that I want you guys to get is, how do you stretch stuff? All you need to know on how to stretch something is what it does. So whatever it does for a living, you do the opposite stuff and you will be stretching it out, right? Because when it shortens, it does the stuff that it does. So in order to lengthen it, you move in the other direction. So we have the biceps again, and we're talking about the long head, and the same thing for the tricep, right? The long head. Why? It becomes a little bit more nuanced on how to stretch it out. Because, when you're talking about uniarticular muscles. You know, I think there's another thing that I emailed you guys about passive and active insufficiency. They can't really have it. And the main reason for that is uniarticular muscles, you can't really stretch them. They did a study on this, which is one of these studies which I kind of find amusing. It's like, you know, they get a bunch of money together and they do all this stuff, and they're like, you can't stretch the quad that doesn't cross the hip, right? So the quads, you got 4 of them. One of them crosses the hip joint, the rectus femoris, okay? The other 3 don't cross anything other than the knee. And what they basically determined in a normal subject, you can't stretch the muscle. If they are in a cast, if they are immobilized or whatever, then yeah, that stuff can shorten. You may have to stretch it out. But in a normal person under normal circumstances, there's no way to get that muscle on stretch, because you'll never flex the knee enough to really put enough tension on it where you're really stretching it out. Biarticular muscles, easy to stretch. So like to stretch your brachialis, you would have to move your arm in a way that it does not, nature does not allow for it. If a person's in a cast, then for sure that muscle is going to shorten from immobilization, okay? But under normal circumstances, you really can't do it. But with the bicep and the long head of the tricep, you can stretch those muscles out. Just go over how. Don't worry about how long and how many. We're going to get to that at another time. But for now, how could you put those muscles effectively on stretch? And just again, what you got to know is where they start, where they end, and what they do. And you'll definitely be able to figure out how to stretch it out. So that's the whole deal for the lab. A couple minutes video, just talk it out, just describe what you're doing, okay? For those 4 things, 2 muscles that you're gonna do contractions with, and the 2 that you're gonna stretch. If you need 2 videos, you make 2 videos. Jarrell, does that answer your question? You have something else?
You know, I was just kind of trying to give see if you can give me an idea how to concentric and eccentric contract the pronated teres. But I think I figured out a way.
Well, yeah, I am confident you guys could think about it. Yeah.
Yeah,
And I want you
so-
to do that. Now, look, if you struggle, it's a weird muscle. That's why I included it.
Yeah.
I want you to think about this. I have ways that I do with my patients, but it's a little bit weird to think about. So just try to think it out. And, you know, when you guys post, we'll give you feedback. But yeah. So that's it for the lab. But let's just go back for a couple of minutes and just talk about a couple of these questions that are included here, okay? So we have follow the demonstration for the valgus test, right? So when I'm pushing into valgus, okay, which ligament potentially am I gonna be pulling on? So remember, valgus is I'm pushing this way. I'm pushing in medially onto the elbow, right? So if I'm pushing medially, I'm gapping the medial side. So which structure am I going to be pushing on? It's going to be that ulnar collateral ligament, right? And its components, okay? That's what's resisting valgus forces. When I push into varus, right, it's going to be the lateral ligaments, right? The lateral collateral ligaments, the radial component, the ulnar component, right? I'm going to be pushing on those. So each of those tissues are going to be undergoing a tensile force. I mean, I feel like I'm like being interrogated. So when I push in a valgus direction, the medial side of the elbow is gapping, tensile force on the ulnar collateral ligament. When I push in a varus direction, lateral collateral ligament under tensile force, right? I'm gapping that lateral side. What do we have here? Oh, arthrokinematics, okay? When I'm doing the open chain pronation and supination, right? Remember, it's the radiohumeral joint and the radioulnar joint, the proximal radioulnar joint. We're talking about the elbow. The arthrokinematics there are spin for both of them. They're both just spinning in place. The radial head, it spins like this on the capitulum of the humerus. And then when I'm talking about that radial notch, now I've got it like this. I've got my annular ligament hugging the radial head. Now I just spin like this. So I'm either spinning on this thing, well, this is flat and this is round. I'm either spinning like this or I am spinning like that. Okay, they're both spinning. The humeroulnar joint does not participate in pronation and supination. Like we said, Purvi had a really good question about when I'm in the closed chain, the humeral ulnar joint is not actually pronating or supinating. It is going along for the ride as the humerus internally and externally rotates. All the orthokinematics are generally the same, except for at the distal radioulnar joint. Now, instead of concave on convex that I have in the open chain, right? Now I've got convex on concave, because at the distal radioulnar joint, my ulna, which is going along for the ride with my humerus, is now moving at the distal radioulnar joint, where it does perform pronation and supination, but now the orthokinematics have changed, right? So I think we talked about that in the lecture. Okay. Oh, last thing here. I think this is the last thing I wanted to talk about. For the three muscles that we palpated, what is normal range of motion for supination, pronation, and closed kinetic chain? That's a really good question. I mean, theoretically, you would want to have the same amount of motion at the forearm. So, you know, we think of 90 degrees roughly in either direction for pronation and supination. I think in some things you're going to see pronation can be less than 90. I think even maybe some texts will say 80 in either direction. It's around 80 or 90 degrees. So it theoretically should be the same. You know, but now we've got this other joint involved. So if there's a shoulder restriction or something going on there, maybe that now limits the amount, but it should theoretically be the same thing in the closed chain as well. So like I said, 80 to 90 would be considered normal. Depends on who you read. Palpating these elbow flexors here, okay? So just to kind of go over the whys of what we're doing. When I want to palpate the biceps brachii, I want to supinate the, let me go back to the spotlight here. I want to supinate the forearm. Why? One of the things that my bicep does is supinate the forearm, okay? So you can even see, if you kind of look at my bicep here, if I'm in a pronated position, it just kind of turns off. When I supinate, it kind of pops up a little bit, right? So now if I have resistance, it would pop up a little bit more. So when I'm testing, I need to have the forearm supinated if I want to A, test the bicep contraction, or B, want to palpate it better, okay? I need to have the forearm supinated because that's one of the things it does in addition to elbow flexion. If I have my forearm neutral, right? Now my brachioradialis, because it works optimally in the neutral pronation and supination position. So if I want to palpate it, I want to test it, I want to see if it hurts, whatever, I want to resist elbow flexion in this neutral position because I know that my brachioradialis is going to be the primary driver. If I go into full pronation, now my bicep is on what, well, I could just ask you guys, or I can just tell you. So think of active and passive insufficiency at this point, right? So if I have my forearm pronated, well, it's not really passive and active insufficiency. Let's call it the length tension relationship. It's not on, it doesn't have a good length tension because I put the muscle on a little bit of tension by pronating my forearm. So let's not think of it as active and passive insufficiency right now. But just think of, because my bicep supinates the arm, if I put it in pronation and I keep it there, now my bicep is not activating at all. It's not able to pull the forearm into supination. So I'm not having, it's going to have a very weak contraction because the length tension isn't good. You could basically call it a passive insufficiency because it's lengthened slightly because it's pronated at the forearm. So now it's lengthened a little bit and I'm not going to get a very strong contraction. But because it can't perform its other job of supinating, it's just not going to fire. So what does that mean? My bicep's not working. My brachioradialis, for it to fire well, it's going to be in neutral. That's not working. So now the only thing that's left that can now have the strongest contraction is my brachialis, because that is independent of forearm position, right? It doesn't do anything at the forearm. But in a pronated position, I take the other ones away. Now my brachialis is doing the most work. You could try to palpate this on yourself. Like I said, you kind of go in this lateral ridge here. You kind of sit lateral to the bicep. You could kind of start to feel it's a very tricky muscle to palpate. But just think of this idea. You want to get just off the lateral ridge of the humerus, kind of get underneath the biceps on the lateral side and see if you could feel that little muscle pop up, because I'm kind of pushing my thumb on the interior aspect of the humerus. See if you could feel, like I can kind of feel it here, this little muscle popping up right under my thumb when I go to flex. And if I pronate, I can probably feel a little bit more than before, but see if you guys can mess with that a little bit. It's also tricky to do. If you have a partner, it might be a little bit easier. On your own, it's a little bit tough. I think that's it for now. So we went over the review. I recorded it. I've got to just, it's got to, go through its formatting or whatever, and then I'll post it. So you guys will have the review. You'll have the elbow lab. And then you guys post, I know like a bunch of the class, 7 or 8 people don't have power right now. So, try to post them today if you can. It's good to use this time that would normally be the lab time. So you can use that time now. If you don't do it today, no one's gonna, kill you for it. So that's fine. It's exercise 4. So on the video on Flipgrid, you're gonna do some kind of a resistance exercise. Again, you can literally use whatever you want, a shoe, like I totally don't care, to demonstrate some eccentric and concentric contractions of the biceps and of the pronator teres, and then demonstrate for us a stretch of the biceps and the triceps. So just post that up when you can. Anything else? Cool. You have any other questions about anything? Drop a line. We'll give you that feedback on Flipgrid. And yeah, I guess now that's it. That's all we have. We have the final 50 questions. And yeah, in between now and then, you have any questions, let me know. But it's going to be the same format as the midterm. Now there's just 50 questions. I want to talk to Dr. Mazaracchio. Do you guys have anything else that day? There's nothing, right? I'm going to talk to him about doing the test later in the day. I know some people, I don't want you guys to have to roll out of bed at 5:30 in the morning because we don't have anything afterwards. It's not like we have to run a class after the thing like we did for the midterm. That made it a little bit tricky. But if you guys wanted to do the test, you guys partially decide that too. So if you come to a consensus that you want to start it a little bit later, I totally don't care. Let me just run it by Dr. Mazaracchio for a second, just to make sure that he doesn't care. And if he doesn't care, I certainly don't care, and we could start a little bit later. I think you guys you'll have 75 minutes to complete the test. So just for West Coast people and, whatever other time zones, I think a little bit later would be good instead of getting up like, farmer's time at 5 o'clock to take the test at 5:30. That would be annoying. So we could probably not do that. So let me know what you guys think, and I'll let you know what Dr. Mazaracchio thinks. Cool. I'll post the video of this soon. Start working on Flipgrid if you guys want today. But if not, like I said, you don't have to do it right now because I know a lot of people aren't going to be able to get it done with the power and stuff. But, let's say by Friday, definitely have it up, just so we could go through and give you feedback. You have ample time to go over any mistakes and stuff in between that time and the final next Wednesday. All right, guys, cool.
Did you happen to post a new Flipgrid link or?
Oh no, I could do that. I can do that. I'll send you guys the link. If you go to the link of the grid, it should be there. But I'll send that to you guys now to the new topic.
Okay, thank you.
Cool. All right, guys. Thank you. If there's nothing else, I will see you guys if you have any questions.
Professor,
Yes.
which exercise part of the lab do we have to upload to Flipgrid?
Exercise 4, concentric eccentric contraction of the biceps and the pronator teres, and the stretch of the biceps and the triceps.
Okay, thank you.
Mm-hmm. All right, guys. Thank you.
Thank you.
Thank you.